of people registered. Oops. All right, got it. We do have a lot of people registered, so definitely use the chat box for any comments or questions, and especially when we get to Dr. Webb's portion. So COBA's mission is to promote, protect, and support breastfeeding in Oklahoma. And next slide, Heidi. And our vision is a state where all children have access to human milk. COBA's values include respect and compassion, inclusion and diversity, evidence-based practices, and family empowerment. So next slide, Heidi. COBA has, this is not an all-inclusive list, and we'll have to start listing some of our funding sponsors in future meetings now, Heidi. So, but COBA is a member of the U.S. Breastfeeding Committee and has been since its inception. We partner or work closely with Oklahoma Breastfeeding Resource Center. That's kind of my paid hat over at the university, and several of our members will be on today. The Office of Perinatal Quality, well, there's the Office of Perinatal Quality Improvement, and then they actually manage the Oklahoma Perinatal Quality Improvement Collaborative, the OPQIC that you see there. And then, of course, our state health department and their initiative, Preparing for a Lifetime, which is the statewide initiative to reduce infant mortality in Oklahoma. And of course, our Oklahoma Mother's Milk Bank. So next slide, Heidi. And of course, we wouldn't be where we are today without the great work of our executive director, Heidi Russell. So I'm going to turn it over to her to do some additional introductions.
Well, it is my pleasure to serve the Coalition of Oklahoma Breastfeeding Advocates and to serve with such an incredible board. You've already met our board chair, Becky Mantle, and we have, actually, I want to just give a shout out. I was telling several of the folks this morning that we have 85 folks registered for today's meeting. So we're super excited, and welcome to everyone. And also we have our friend Brenda Bandy from the Kansas Breastfeeding Coalition. So we're always excited to have friends from outside our borders. Today, we would like to introduce our other board members. Also, we have Julia Profit, who is our vice chair. And then also joining us today, we have our secretary, Cheryl Coleman. And if you are fortunate to get our emails and our newsletters, which I hope you are on our list, Cheryl is responsible for the wonderful newsletter that we do that comes out the beginning of each month. If you're not, please go to our website and you can sign up. And our wonderful treasurer is Alexis Borka. And she also serves as a breastfeeding peer counselor here in Oklahoma City. And she's been very active with our La Leche League as a leader. And one of our other board members, Lily Beth Sanger Brinkman from NBC Bank. Erin Kopenbarger, who is a registered and licensed dietitian at the Oklahoma Heart Hospital. And over in Tulsa, serving the Tulsa Health Department as a breastfeeding peer counselor, we have Rose Hurd. And then also over in Tulsa, another registered and licensed dietitian who used to work at the WIC state office, we have Kelsey Watkins. Well, it is my distinct pleasure right now to introduce to you all our new advisory council members. We're so excited this year. In 2021, we added an advisory council to COBA to really kind of be that wise counsel for us and to spread our net a little wider. And I know that we just admitted to the meeting. We have Maggie Green, who is in Oklahoma City, and Maggie is a licensed clinical social worker. She is the owner of Greenworks Counseling, Coaching, and Consulting. And you may also be familiar with Maggie because she does a lot of work at the Oklahoma City County Health Department in maternal and child health outreach. It is also my pleasure to introduce to you Dr. Monica Henning. Dr. Henning is over in Tulsa. She is on faculty at the University of Oklahoma as an obstetrician and gynecologist. She also works with the Focus Forward Oklahoma program, which is a joint initiative with the Oklahoma Healthcare Authority, the University of Oklahoma, and the Oklahoma State University Health Sciences Center. She also serves the University of Oklahoma as the Student Clerkship Director. It is my pleasure also to introduce you to Donna Lawrence from Oklahoma City. Donna is the president and founder of Success Redesign. Donna is also one of the founders and founding board members of Oklahoma Women's Coalition. April Stewart is joining us today. April has a master's in public health. Although she lives in Oklahoma City, she hails from Tulsa, just down the turnpike, or up the turnpike. She also is a former board member for Coalition of Oklahoma Breastfeeding Advocates. She currently serves Presbyterian Health Foundation as its Director of Grants and Programs. It is also my pleasure to introduce you to Amanda Swain, who is the mother of 3 children, all boys, and as an attorney, a practicing attorney, she breastfed all 3 boys as a practicing attorney. She lives in Norman. She works in Oklahoma City as the partner of Swain Trusts and Estates Law. And then it is my absolute pleasure to introduce you to Dr. Melinda Webb from Stillwater, Oklahoma. She is a pediatrician, and you will hear more from Dr. Webb this afternoon during our question and answer. Dr. Webb serves as the breastfeeding coordinator for the Oklahoma chapter of the American Academy of Pediatrics. And now Becky will give us a very exciting legislative update.
It's a lot of fun on this part. Can y'all hear me? Yeah, there we go. So on the federal level, for the first time ever, we had a standalone breastfeeding bill that was voted on in the House. It goes on to the Senate, where I'm sure it's going to pass just fine. But it did pass with very strong bipartisan support. And this is what was known as the PUMP Act. And this is actually closing the gap in the federal labor legislation that was passed in 2010 with the Affordable Care Act. And it left out about 9 million mothers, so or breastfeeding parents. So we're excited to have that gap closed. And I think it's important for this audience to know that all 5 of our Oklahoma Congress people voted against this bill. So I have that on your radar. Okay, next slide, Heidi. COBA also participated in a interim study earlier this month, just starting the conversation, or actually continuing a conversation that started last year on looking at how to accommodate lactating parents who are incarcerated in our state prisons. And we had, Heidi did a lot of great work behind the scenes to get this study organized, and we had special presenters from the Alabama Prison Birth Project. So that was very successful. Whoops, went back. Go forward, Heidi, there.
There you go.
It was requested by Senator Carrie Hicks, and then of course Senator Joanna Dossett, who is pictured there with Heidi and me, was the actual host for that. She was so excited. That was her very first interim study to host. So and next slide, Heidi. We got to stay on track here. Yeah, some updates. Many of you are aware that we had Senate Bill 469 that was going through session earlier this year. and it did pass through the Senate and unanimously passed the Appropriations and Budget Committee subcommittee in the House. And then, of course, it kind of hit some deadlines. There was other priorities. So it's actually dormant. And since our session lasts for 2 years, this bill will re-engage in February, and just really needs 2 more votes before it goes to the governor. So we have, really high hopes for that bill's passage. And it's in the House now. Senator Kerry Hicks was the primary Senate author, and it will be sponsored by Representative Carol Bush as the primary House author. So next slide there, Heidi. And then, of course, we were so excited to have Senate Bill 121 signed into law this summer. So this took effect July 1st. And this, at least it was Oklahoma's effort to close that gap and make sure that all public school employees have not only protected break time, but paid protected break time for pumping, and that schools make a reasonable effort. So, and I think we've now got Carrie Coppernall, who's gonna tell us a little bit more about how COBA's partnering to help make that happen. So, Carrie with Oklahoma Education Association.
Thank you so much, Becky. We are so proud to partner with COBA, and we produced a website, oka.org/workingmoms, where we've got resources for schools, how they can support breastfeeding parents at their school sites. And we're also going to deliver printed materials to 2 sets to every school district in the state, and along with 1 set to all of our presidents of our organization, the Oklahoma Education Association, about how you can support and also follow the law, and sample policy for their school boards, posters, and door hangers that ask for privacy. So we're really excited about those kits and being able to support parents. This is something that comes up at many of our schools every single year. So we're excited about the legislation, and we're excited about educating our administrators and our teacher leaders about how to support parents in this role. So we just appreciate the opportunity to work with COBA.
Thank you, Carrie. I have to say that it is, Carrie and I have known each other for quite a while. And then when I found out she was at OEA and that she was going to be working with us, it was just an absolute, just pure excitement. And she has been just fantastic to work with, as Catherine Bishop and Alicia Priest before Catherine. So thank you so much. Cheryl Coleman.
All right. COBA was so excited this year to be able to offer and initiate a scholarship program. We really were very grateful for the funding that we received so that we can do this to increase our diversity and availability of lactation support across the state of Oklahoma. So it's my pleasure to introduce to all of you our first 4 scholarship recipients. First one is Kiki Burris. She is an education scholarship recipient as a breastfeeding peer counselor from Tulsa County Health Department. Also, Victoria Godwin. Victoria is a nurse at Cherokee Nation W.W. Hastings Hospital in Tahlequah, and she received the education and the IBCLC exam scholarship. Brianna Landry received the education scholarship. She is a breastfeeding peer counselor at Grady County Health Department. And last but not least, Carrie Nelson also received the exam fee scholarship. She is a breastfeeding peer counselor now at Creek County Health Department. So we are incredibly pleased for these 4 wonderful women who are now very involved with COBA to receive these scholarships and spread the great word. So if you want to know more about our scholarship program, what we have are 2 avenues for obtaining a scholarship. One is for the IBCLC exam fee. And as you can see, the cost for first-time candidates and those also who are recertifying, as well as the education scholarship, excuse me. So as anybody who's been through this process knows, it takes time and it takes money. And so this is one way that we felt we could really support all those across the state who are interested in providing additional lactation support for clients. The deadlines, we do have a couple of deadlines coming up. If anyone is interested in the IBCLC exam scholarship, the deadline is January 30th. And for the education scholarship, it is March 31st. And the additional information as well as the forms can be found on our website at okbreastfeeding.org. The goals of our program are to increase, as I said, the number of lactation consultants across the state of Oklahoma, to increase our equity in lactation support, to support the continuing education in the lactation field, and really increase the training and support for all of our families to achieve our goals of human milk available for every child in the state of Oklahoma. The focus areas are certainly first-time candidates and minority groups, and those serving minority groups are planning to work in any underserved areas across the state of Oklahoma. So again, really excited about this program. We've had great success so far, and I would encourage anybody who is interested to contact the central. Oh, there, did we not have the frequently asked questions? Did that slide disappear? Heidi, there was a question. There was a frequently asked questions. Well, one of the questions that we've heard is, can you apply for both? And the answer is yes. As I mentioned before, we know it takes time for the education to get to the point of taking the exam. So maybe that as you get started, someone who's getting started in the field of lactation may want the education fee to get going with that. And then later on, when they become ready to take the exam, can apply for the exam scholarship at that point in time. Did you find that slide, or did it disappear?
I think it must have disappeared, but I do.
Okay.
I'm sorry, Cheryl. One of the questions that folks frequently ask us is, can I apply for a scholarship if I've already paid for the exam?
Right, and of course you can. We verify the exam application before we give the scholarship money. So yes, if you've paid for the exam, find out about the scholarship, you can absolutely go ahead and apply at that point in time. And I think there was one more question on there, wasn't there, Heidi? Can't remember what it was though.
Let's see. Oh, can you apply for both education and IBCLC at the same time?
And I answered that one already.
Yes.
Okay.
And then if you've already started, or do I have to already start on the IBCLC journey before applying for an education scholarship?
And the answer to that is no. You may be getting started, want to increase your skills as a peer counselor, want to increase your knowledge base to help patients in whatever setting you're in. So absolutely go ahead and apply for that scholarship, education scholarship ahead. As I mentioned before, and as we all know, this takes a lot of time. So this may be your first journey into like the field of lactation. Get that education, start supporting families, and working towards that IBCLC maybe on down the line a few years. So no, sure don't. So I think we got them all.
Perfect. Yeah, it must have gone into the PowerPoint la la land. I do want to recognize that we have had two wonderful initial funders of our scholarship program. And these funders have made it possible for us to, one, begin the program, but two, fund these programs. It is the Robert Glenn Rapp Foundation and the W.J. Jones Family Foundation. And I saw that Brianna Landry, one of our scholarship recipients, and Kiki Burris are with us today. And then real quick, before we ask Alicia Lincoln with the health department to talk about the period of purple crying, just remember, if you can mute your microphone, that would be great. And it is my pleasure to introduce Alicia Lincoln, who serves as Administrative Program Manager, Child and Adolescent Health for Maternal and Child Health Service at the Oklahoma State Department of Health.
Dixie, come out of there. Good girl. Thank you. Hello, can you hear me?
Yes, we can.
Awesome, excellent. Thank you for inviting me today. I just want to give a quick overview of what Period of Purple Crying is and how we might be able to work together to sort of cross-pollinate breastfeeding support to help families reach their goals and also to help keep families and babies safe. So I'm going to share my screen.
All right, Dixie, come on, let's go. Come on, Dixie.
And
Everybody, please remember to mute yourself so we can hear the speakers. There's still several people, I think, that are not muted.
all right, so I think you can see my screen here.
We can see your screen.
Okay, great. So there it goes. All right, so what is Period of Purple Crying? So the Period of Purple Crying is an evidence-based program has two goals. So the first is to educate new families, new caregivers on what infant crying looks like, particularly in those early months when we know that infant crying tends to increase. And the second is to reduce harm to infants from abusive head trauma or shaken baby syndrome. So it was developed by the National Center on Shaken Baby Syndrome and Dr. Ronald Barr, and it uses a child development approach to educate about normal infant crying, the frustrations that crying can sometimes be a trigger, how to cope, how to soothe, and then of course to remind them that it's never okay to shake or harm the infant. So why do we call it the Period of Purple Crying? It's an acronym, as all things in public health typically are. And so that first P, again, addresses that peak. So babies cry the most generally leading up to month 2, and then it kind of tapers off, can be unexpected, resist soothing. Babies may make a pain-like face. It can be long lasting. For those of you like myself who've had a high crier, 5 hours a day is not an exaggeration. And it can become very frustrating no matter what kind of soothing techniques, et cetera, that you use. And oftentimes we hear parents use terms like bad baby or good baby. That's a good baby, right? He doesn't cry very much, or he sleeps through the night, he's a good baby. And we want to reinforce, so there's no such thing as a good baby or a bad baby. It's just that some babies cry more than others. And then it happens in the evening. So babies cry more in that late afternoon and evening, all of you know this. And that can be incredibly stressful, especially if you have, that's when families come home and they come home from work or from school and they're trying to slip into some relaxation time. And that can often be the time where parenting a newborn can be the hardest. So in Oklahoma, we administer Period of Purple Crying in 2 ways. The hospital is the primary method. The apps are printed, well, there's a booklet that's given to new parents, and then there's a code for the app, or there's also DVDs if parents don't want to put it on their phone, or depending on the languages, if it's Arabic or Chinese or something that's not as common, there's a DVD given with the booklet. And then the healthcare provider has received some training, and they may go through the booklet and then turn on the video or show the parents how to access the video. For Oklahoma, we're kind of unique in that we try to have a statewide reach. A lot of states, it's hospital by hospital. So for us, we administer the program through the state health department, and we cover about 39 birthing hospitals, which is about 85% of Oklahoma births statewide. So there's a pretty good swath of folks who get what we call a dose wide.
Alicia, you're a little bit muffled or something.
Okay.
People are asking if you can speak a little louder or maybe and we can see you again now too. So
Okay.
oh,
Yeah,
that's much better. That's
I'm
better.
trying to, is that louder? Okay,
Yes, no,
I'm
that's
sorry. Okay. And so the first dose is in the hospital, and then the second dose is in the community. And that can be through prenatal care visits. It could be through a WIC peer counseling visit. And then pre-COVID, we had a pretty robust partnership with the Parent-Child Center of Tulsa, and they had a barbershop program where they would go into barbershops and talk to dads. And uncles and grandpas and other potential caregivers about the period of purple crying. So I have a video, it's 30 seconds. I'm going to see if it will play, but please let me know if it doesn't. And I can't see the chat, so feel free to interrupt.
Alicia, I think in the interest of time, and it looks like it's not playing right now, maybe you can put a link in the chat box.
Sure.
And people can watch it a little bit later.
Yes, I can definitely do that. With Zoom, videos are always
Oh, I know.
50-50,
Been there, done that.
right?
Yes, yes.
Okay, so basically, this is what the app looks like. It's in English and Spanish. So this is the Spanish side, or the Spanish version. And it talks about crying, soothing, coping, and sleeping. It has a copy of the book that the parents are provided, so it's in the app in case they lose the book. But it also allows parents, so these are articles, they're videos, they're infographics. However that parent feels most comfortable receiving information, there's probably a mechanism for them within this app. But it also allows parents to go down here to this little graph at the bottom, click it, and it pulls up all these different ways that they can track. So they can track how long they've fed the baby, which side of the breast they fed the baby from, how long baby cried, sleeping, diapers, wet diapers, poopy diapers, pumping, baby's weight, and even their vaccinations that they've received. And so this is kind of what that feeding tracker looks like. So I can start nursing, push start, then put my phone to the side, and then when I'm switching sides, I can hit stop and then start on the other side. And then it gives myself or my provider or the baby's provider a nice sort of graph to kind of look at to help diagnose issues, or just kind of look at what the patterns are for baby. Sorry, didn't have that off. Okay. So, like I said, we are in about 85% of the birthing hospitals. We cover about 85% of the births statewide, but there are still ways that folks can participate. If you work in a birthing hospital and this is new for you, you've not seen this, and you can check with me and we'll see if your hospital participates. And if they do, maybe who you can talk to kind of integrate this if you're interested in terms of helping parents track breastfeeding or diapers or whatever. I know when I was a new mom, I was given a piece of paper and a pen and, you know, document all these, you know, wet diapers and when you feed them and et cetera, et cetera. And sometimes it gets a little hard to keep up with pens and paper, but most people have their phones on them all the time anymore. So that's kind of what makes the app nice. If your hospital doesn't participate, or if you're a provider outside of a hospital system, you can still participate. You sign an MOU with the health department that says I agree to take the training and administer the program with fidelity. And then you take the training and then we provide you the supplies. So there's no cost to you other than time, really. So, and that just helps us then spread the message that infant crying is normal, gives parents some tools, but it also helps potentially meet their breastfeeding goals too. And so anytime that we can take that, all those different pieces of preparing for a lifetime and our infant mortality reduction work and kind of tie them together, we like to do that. So we're all working towards the same goals. So that's all I have. If you have questions, you want to see a copy of the app, you want to talk to me about how you might start participating, this is my contact information. Feel free to reach out via email or phone. That's not a texting number, that's my work number, just FYI. And otherwise, I will stop sharing my screen, and I just thank you for your time and attention today.
Thank you, Alicia. Okay, real quick, before we start our Q&A with Dr. Webb, Holly Skinner from the Oklahoma Mothers Milk Bank.
Know if you can see me.
We can.
Okay. Well, I don't know what I look like because I can't see myself. So I just wanted to jump on and give you guys a quick rundown about our biggest fundraiser. So this is an annual event. First, if you don't know about the Oklahoma Mothers Milk Bank, I hope you do. We are a nonprofit human milk bank. We're the only one in Oklahoma. What we do is we collect breast milk from healthy screened donors. We pasteurize it and we send it to hospitals across the state. So we serve all of the major NICUs in the state and even some mother baby units. We also ship milk to a couple of other states that don't have milk banks right now. So that's really great too, that we can serve some of the bigger states. Our biggest fundraiser of the year is Pints for Preemies. That happens in February. In 2022, it will be happening on February 24th. And this year it is called Pinot and Pints because we are offering wine as well. And basically what we do is we have a brewing company, and this year we have a wine vendor as well, and they provide drinks for tasting, and we sell sponsorship levels, and everyone is welcome to come. We're hoping to be able to tour the new milk bank space that we're hoping to move into. It's just a really great time for professionals to do kind of a meet and greet, but it's also a good time for us to talk to the community and our donor moms and things like that. So it's very intermingled. So physicians to donor moms to IBCLCs to WIC peer counselors to anyone who is interested in donor milk and supporting the cause. And the great thing about this is that this year in 2022, it is a joint collaboration between the milk bank and COBA. So we will be raising funds for both. So if you are a supporter of COBA or you are a supporter of the milk bank, we would love to have anybody. Like, we are so excited. We are so excited. And we're so excited to have wine.
Thank you, Holly.
Yeah.
All right, well, I'm going to just wrap up our business portion of the meeting with a few reminders and then a major announcement. So don't forget to apply for a scholarship. Check those deadlines. Email us if you are interested in serving. We are still currently recruiting for board members and people, to serve on our various committees. So if you're interested in serving in a leadership capacity, mark your calendar, of course, for the Pinot and Pints for Preemies on February 24th, and also the Becoming Baby Friendly in Oklahoma Summit, which is Friday, February 25th. So stay tuned for that. We actually have Dr. Tom Hale and Jennifer Thomas, a pediatrician, who will be our keynote speakers this year. And then last but not least, I'm not even sure that all of our board members have heard this news, but I am very pleased to announce with all the hard work that Heidi Russell has done, she has actually now helped COBA be awarded a $40,000 grant from the Masonic Charity Foundation with two aims. One is to support the Working Moms Work toolkits and resources for the schools with the passage of Senate Bill 121. And the other is to continue to support our growing scholarship program. So we were ecstatic and actually shocked at the size of that grant, which was just awarded a couple of days ago. So thanks to Heidi for all her hard work in recruiting that funding, and hopefully that will be a partnership that we will continue with that foundation. So, all right, so thank you to everyone for all of the reporting and presentations today. And now I'm excited to turn things over. Heidi, are you going to kind of kick this off? with our next portion.
I am. Let me pull up one thing.
Did we lose Heidi?
Okay, I'm here. I'm here. Let me make sure that I'm sharing the right screen.
There we go.
Okay. We are back. Can you hear me?
Yes.
Perfect. Well, it is my pleasure to introduce our wonderful moderator today, Kamisha Busby, who comes to us from the Oklahoma State Department of Health. And she has been working as the Maternal and Child Health Equity and Special Projects Manager since December 2019. In this role, Kamisha works closely with her colleagues in focusing on the reduction of infant mortality and premature births while empowering families and encouraging healthcare providers to provide quality and equitable care to their clients, which she holds dear to her heart. Kamisha also serves as the Quality Improvement Coordinator in Maternal and Child Health Services, addressing maternal health, and is active on other community-based committees that focus on maternal child health, including serving as a past healthcare chair of the Infant Mortality Alliance Health Work Group of Oklahoma County and current agency lead for the Health Disparities Work Group of the Oklahoma Maternal Health Task Force. Having the experience of working for both nonprofits and local government, Kamisha brings over 16 years of public health and nursing experience and knowledge to the field. In the community, she currently serves in several capacities. She's a board member of the March of Dimes, Oklahoma chapter, Family Builders, Greater Mount Olive Baptist Church, and the Stork's Nest of Oklahoma City. Kamisha holds a master's in business administration with a focus on healthcare administration from Southern Nazarene University, and she has a bachelor's degree in public health and a bachelor's degree in nursing from the University of Central Oklahoma. Kamisha, thank you for the wonderful work you do, and thank you for your support of Coalition of Oklahoma Breastfeeding Advocates. You are a wonderful champion, and we are so pleased to have you with us today.
All right, thank you so much, Heidi, for the warm welcome. I have to shorten my bio because I didn't realize it was that long. I do so much work, but I want to thank Heidi and her team, and also the board members of the Coalition of Oklahoma Breastfeeding Advocates for selecting me to moderate this session. So we're going to go ahead and get started. I have the great pleasure and the honor in introducing our speaker for today, Dr. Melinda Webb. So just tell you a little bit about Dr. Webb before I turn the floor over to her and we begin our Q&A session. But Dr. Webb is a native of Beaver, Oklahoma. She's a board certified pediatrician in Stillwater. She also began her education at Oklahoma State University with an undergrad degree in microbiology. She then earned her medical degree at the University of Oklahoma College of Medicine. Her husband is from Arkansas, so they chose an excellent pediatric program at the University of Arkansas for medical sciences for her residency. After her chief year, she joined the faculty and ran the newborn nursery rotation and completed the first WellStart International breastfeeding education rotation prior to starting that job. That's awesome work. She then worked closely with the Office of Breastfeeding Services through the Arkansas Department of Health. Dr. Webb and her husband then returned to Oklahoma after nearly 10 years in Little Rock to raise the 2 children in the small town. She currently serves the Oklahoma chapter of the American Academy of Pediatrics as a breastfeeding coordinator. She also describes her practice as being very busy, serving North Central Oklahoma, and is still attending all high-risk deliveries. She's very knowledgeable in all stages of the child's lifespan, from supporting and promoting newborn health and breastfeeding to the medical issues and the concerns school-aged children face, to children with special needs. I would like to say Dr. Webb is very accomplished. She's made a huge footprint in the communities that we serve, more especially in the realm of breastfeeding. So it is my pleasure and my honor to introduce Dr. Webb as she provides a little bit of feedback to this group and then be able to answer the questions that you all might have. Dr. Webb?
Thank you for that wonderful introduction, Kamisha. Appreciate that so much. I just wanted to also say, I don't attend all those deliveries by myself. My group does, but I wanted you guys to know that we are still a full service pediatric group here. I think a lot of places now, the pediatricians don't get to do as much nursery, and we're trying some new things now. So we see the gamut from preterms all the way up until our adolescents here. I also just want to say thank you to the coalition. You guys do great work. You really make our lives easier. All the lactation consultants, the peer counselors, all the background health department workers, everything that is done just helps so much. We use the helpline, we use resources, we use all that. So we thank you so much for making those things available to us. I really didn't have a whole lot of prepared remarks other than saying thank you for what you guys do, and just to let you know that we definitely struggle with time sometimes to help moms and babies as much as we would like, which is why the role of support people is so great and why we have to keep that education going. That doesn't mean that physicians don't need to be educated, because I can give you a few examples of where that comes into play as we go through these questions. And we're still working on trying to educate all our providers, helping them figure out where the resources are, helping them to figure out when they need resources, and also just setting the stage for successful breastfeeding. And I think that is one thing that we sometimes don't do very well. And again, we may talk about that more as we go through with some of these questions. So I'm happy to hit the ground and start with questions.
All right, thank you, Dr. Webb, for that background. There's a lot that's going on now, especially that we've been dealing with in almost 2 years now when it comes to COVID-19 and our health. So we know health officials could authorize a COVID-19 vaccine for children ages 5 to 11 years within weeks, and that pediatricians will be the go-to source for accurate information. So what should parents know about the vaccine for their child? And how can healthcare professionals work with pediatricians to get accurate information to the families?
Well, first of all, I think there's a lot of misconception that this has been, of course, a rushed vaccine, that we don't have enough data. And so I just reassure people that, the science was there ahead of time. This was kind of ready to go with a pandemic, and then we were able to hit the ground running and get the vaccines up and running very quickly. The FDA also requested additional data. So for the children, and I don't think that they have rushed this at all. I think that they have looked at that very closely. So I would say once the FDA and the CDC approve, we should feel confident that things are safe and ready to go. That said, we are going to find there are going to be some side effects that pop up. There are going to be mild things like soreness and muscle aches and fever. But I think everybody trying to get the message across that this vaccine is probably one of the best ways we can get back to normal and protect everybody, including those who cannot get a vaccine. So I think that's one thing that we tend to forget is this vaccine isn't just for us, it's for our fellow classmates, our grandmas and our grandpas, our pregnant mama, our friend who maybe can't get a vaccine or who has some underlying condition. So that's probably the message that we need to kind of get out there. That's not just for our own protection, it's for our friends as well.
And I like how you say that instead of just looking at self and how it's impacting me, and looking at protecting others. So this is a really good takeaway from that. So another question that we have, pediatricians are also challenged by providing support and management for nursing issues. I do know that this is a huge one. So in what role do you see the pediatricians play in breastfeeding management and encouraging exclusively breastfeeding?
Well, we have a big role. First of all, again, pediatricians, and not just pediatricians, but family practice OB as well, kind of again needs to set the expectation and the standard for breastfeeding that, hey, this is how you feed your baby. This is nature's the most natural way to feed your baby, but it's not going to be without some work, and it's not going to be without, you need some support and you need to be ready. So I think, first of all, we need to kind of set the stage and kind of understand. Then the other thing that pediatricians need to do is be able to recognize when there may be an at-risk situation and to recognize and support when there might be problems. So when I had my children, I was told, after going home at 24 hours, I was told, we'll come back in a month and we'll see how things are going. Well, by a month, I probably would have been pulling out my hair, already fed my baby cereal. I mean, I may have done all kinds of things, and I certainly wouldn't have been breastfeeding still at the month of age. So I think everybody's changed. I think we're all doing better. So early follow-up, maybe frequent follow-up, phone calls, working with your nursery or your WIC office to help also support those moms. Knowing where to refer and when to refer is also very important. Knowing your local resources, having the breastfeeding helpline available, kind of talking with Leilichi or WIC or whoever, so that you know who you can refer to, or starting to develop those skills in your own office, either yourself or someone in your office who may have done breastfeeding education, so that they can be a little more supportive rather than just, oh, I don't know, give them a bottle.
So the big takeaway I take from that is finding those supports, which is really helpful in making sure you stay on that journey. So thank you. That was some good information. So continuing on when we're talking about breastfeeding, most pregnant women in the United States plan to breastfeed. There is a clear gap between the proportion of women who prenatally intend to breastfeed and those who meet their goal postpartum. What are some of the best ways to support mom-baby dyad through the birth, hospital, and postpartum periods?
That's always kind of a hard one. Again, we've kind of talked about that, but I think prenatally, we definitely need to give those messages. Kind of also explore her plans, really not just ask that at the first visit, because I think that sometimes happens with family practice or OB, and I don't mean to disparage any of that, but sometimes they ask, are you planning to breastfeed with the first visit, and then no other dialogue through the rest of the pregnancy. I've seen a couple of moms recently who had absolutely no breast changes during their pregnancy and had struggled with feeding their baby previous pregnancies, and turned out they had insufficient glandular tissue. If we had kind of talked about some ways to handle that or prepare, I think we wouldn't have struggled so much in the nursery period. I think mom, or in the postpartum period, mom would not have been as frustrated or discouraged. And we could have figured out ways, we could have figured out ways to help her feed her baby that felt more satisfying to her. I think exploring even with fathers and grandparents about their history or their plans. I just had a family this week, and mom was overwhelmed with just trying to get all the message, and she wanted to do everything right. And the dad was there. She had had no sleep. He had had no sleep, but he was a little bit more awake and not quite so worried. And so finally the dad just said, I've got this. I'm going to be the manager. You're going to be the supplier. We are going to make this work. And so I think using family support is also very important to support the dyads.
I love that. Sometimes you need that extra support, somebody come in and take control, especially when you're trying to balance the both. But I also love that you talk about, well, how we need to be proactive versus reactive, having those conversations earlier in the pregnancy and as we go through the stages of the pregnancy, so we can really honor her plans, respect her plans, and help her be successful. So, and the family be successful. So I like that. Before I move on to the next question, I just want to put a reminder, if you are not speaking, could you please mute your mics, because we can hear a lot of feedback coming from you all, and I know you don't want us to hear your personal conversation. So if you can do that, I would greatly appreciate it.
Kamisha, just a second. Heidi, I don't know, since you're kind of the controller there, if you have a way to just mute everybody, and then people can maybe type in the chat box or raise their hand to be unmuted. So.
Dr. Webb has great information. I really don't want us to miss it. So, and I know sometimes we have an issue working with technology. Sometimes we don't know what we need to do.
And Kamisha, I'm going to raise my hand real quick while she's working on that. I have a question for Dr. Webb, just as you mentioned earlier about, pediatricians, of course, needing to be more educated, but also knowing, what resources and what's there in the community where maybe they can refer, especially the newborns to. How can we help? And I hear that with lectures that I give to pediatric residents who think that if they have a 5-day-old in the office and, there's any kind of breastfeeding problems or concerns from the mother, that they have to fix everything and handle everything. And I know they don't have time to do that. Maybe they want to be able to fix it, so how do we get the message and maybe that information out to the, the broader pediatric community of, where they can go, or that they do have options to refer patients to, so they don't spend an hour doing a lactation consult.
Right. I think we're trying to do better and better with, I can do some of that. I need to do some of that more, just to remind people. I think sometimes we get in the thick of things and you forget that you have help. So in my office, we have your helpline posted prominently. We've also developed a nurse and a lactation consultant through the hospital that we just call, and they can come over and help us at that point too. So encouraging other groups to do that. You are working on getting an education module, and we're going to kind of add that as part of our education too, how to reach out and how to also know about your resources. So that's just a message that I think we just have to reiterate over and over again, because we do want to do everything and we tend to forget that we don't have time to do everything. So I think keeping those things in front of us, whether that's that.
She got muted there.
Yes. There we go.
Good job. And we did what we needed to do. I think also I don't have it in front of me. I thought I did, but I don't have a copy. So my nursery has also put out a little page that has all the resources, and they hand that out to the mothers, and then those are in the doctor's office so that I can look at it too and go, oh yeah, there is this person I can call and this person I can call. So those things are also very helpful, just to have that right front and center.
Thank you for that. As providers, we can't do everything, and this is why we have great partnerships and great organizations to help with that support. It's a team effort. Like I said, when you're raising children, it takes a community, it takes a village. Same thing with breastfeeding and caring for our moms. So this is a topic that sometimes can come off as being controversial. Can you address tongue ties and breastfeeding? We know what to do if this situation arises.
I think this is a difficult, it is a difficult conundrum sometimes. As back in the day when I first started, like with WellStart, all nipple pain was yeast. And we kind of had to work through that and try to get to that. Now, every single breastfeeding problem is tongue tie or lip tie, as you guys know. So we have to continue just to learn to assess and assess properly. I think we have to keep working on that. Luckily, there's more and more information, and I was trying to pull up our protocols. So the Academy of Breastfeeding Medicine recently addressed that. So there is a protocol on their website for tongue tie. If you guys are not aware of that, it's the Academy of Breastfeeding Medicine. And that's a very helpful website. It's got a lot of available protocols. And there was it's a position statement, I guess I should say. So that's been recently published this year, kind of updated. A lot that I see is not necessarily something that has to be this is a hard topic, so I don't want it to offend anybody, but I also want to say that we really do have to be careful about that. So, if the baby truly can't get their tongue out or up or over the gum line, and you can see the little heart shaped or the little dimple, then yes, that may be a concern. And the mom is having problems. I can see that a lot of times, and moms and babies do great and they don't have any problems whatsoever. Others, we will do just a clip in the office and see how that works. If they still have a lot of problems, we might refer then to a lactation consultant. And that's really what I would prefer to do, is to send somebody to a lactation consultant or a feeding specialist to see if they truly need that. Sometimes it does seem like it's easier just to refer and have revisions, but we have to remember that those are not without complications. They're not without its own problem. Like some babies will have so much pain that they may then have oral aversion because of that. And there are a lot of other ways that we may be able to support that mom and baby without having to get to something drastic. There's also been a recent report of a death from a treatment of a laser treatment of a frenulum ankylosing. So we do have to be concerned about that. So I also have had available, and if you have this available, working with the lactation consultant, as well as even a speech pathologist who specializes, that's very helpful as well, because there may be some things that they can help with, or they may say, yes, this is definitely causing the feeding problems. My most recent tongue tie was a little premature, late preterm, 37 weeks, who loved her hands, had been sucking her hands in utero, and also loved her tongue. So she came in, she was having trouble latching. Mom had had engorgement. She had retracted nipples. The baby was sucking her tongue, and she kept her tongue up and out. I mean, the tongue had great movement. There was no tongue tie, but the baby just loved sucking on her tongue. So we just had to work with that, and we're able to help that baby learn to get her tongue down and around, and now they're doing much better. But the person who saw them initially said, oh yes, this is a tongue tie and a lip tie, you need to get that taken care of. So I think it's definitely a real thing. There's definitely babies who benefit, who do very well from having their frenotomy, but other babies just need a little bit more work, a little more assessment, so that we can figure out what their true feeding problem is.
Thank you for that.
That's not an answer.
Yeah. Well, I mean, something that was helpful and to what you're talking about, I mean, just having that understanding and protocols in your clinic as a provider of what to do. And in those protocols, you can have that support of lactation support, somebody who sees this all the time. And in addition with the speech pathologist, I never really thought about that, but incorporating them into it too, to see if there's anything that we can do instead of going that next step of having that procedure done of the clipping, where you have to look at other complications. So I actually like that. I learned some stuff today in regards to that. So with the Sooner State is reportedly facing a massive shortage of pediatricians, and it's not just a problem in rural towns. So we're shifting the conversation just a little bit about the workforce. Research shown that Oklahoma has consistently ranked between 45th and 50th in the number of physicians per population, and that there are just 4 states with fewer pediatricians per 100,000 children than Oklahoma: Wyoming, Idaho, Nevada, and South Dakota. So the question is, first, why is there such a shortage of pediatricians here in Oklahoma? And then secondly, what can be done to really combat that situation, in your opinion?
That is hard. So I think in Oklahoma, it's kind of in general, primary care we're kind of short all primary care. We have 2 big urban areas, and that's where we do our training. So a lot of those people want to stay there. I think for pediatrics, it's a little scary sometimes. I already talked about the fact that we still do newborn resuscitations, and we still admit a lot of our patients. We didn't admit during COVID because we didn't have room. We also don't have nursing staff that feels really comfortable. So those two things are kind of scary for those people coming out of residency. They're like, oh my gosh, I'm going to have to be responsible for a 24-weeker that I don't know how to take care of, or I don't feel comfortable taking care of. And I have to do that with no helicopter in sight. So that's kind of scary. So we have to continue to help support pediatricians, new pediatricians with learning and backup. We are starting, and this is exciting. Stillwater is partnering with OU and Mayo Clinic, and we're going to do a teleresuscitation project. So we will have neonatologists looking over us while we do resuscitations. If this works well, I can see that being helpful for other areas. Lawton already is teamed up with OU to help with their NICU. And that may be something that regionally more and more places do. So one, it's kind of a fear factor. Two, it's a support. You know, being a pediatrician, the only pediatrician in the area may be kind of hard. So just having those support. And then we're a lot of isolation in some areas of the state. What can we do about that? Again, more rural rotations, more support. We just have to encourage people to do pediatrics. Pediatrics is fun. You know, these are the only places where you can say pee and poop and puke and boogers. And, you know, that's just kind of fun all day long. And you get to watch kids and see them grow up. It's really fun. We just have to we have to remind them that the scary parts of this are very few and far between, and we will support you through that and help you through that, and just continue to encourage people. And you guys are out there to help with the hard parts of breastfeeding. So
yes, I like that. So from the patient or client side, and I'm having a hard time to decide, pediatrician or family physician, what's the difference?
Well, pediatricians are specialized in pediatric care of newborns to 18 or young adulthood. Family practice, they kind of see everybody. They see the gamut from tiny babies to pregnant moms to 99-year-olds, 110-year-olds. So they haven't had the training, specialized training in exclusive pediatrics. They will do pediatrics rotations, and some of them even do NICU rotations, but they don't have the specialty training or the more intense training that we would have. We do 3 years of residency in pediatrics alone, and they do 3 years of residency that includes, you know, OB, surgery, internal medicine, et cetera. So we're a little more specialized. That said, sometimes there's not access to pediatricians in many of our rural areas. And so we work really hard to help partner with our family practice colleagues to take care of those kids where there isn't a pediatrician around. For example, we have in our system lots of family practice doctors that are based in Cushing or Perry, and if they have problems, they can give us a call or we help to train them. So there's a lot of that's kind of the difference, but know that we're also there, that we can act as backup.
Nice, that support. Because I know sometimes, and I've heard some stories where you have your ER docs or your family physicians that end up with a pediatric case and they're not quite sure what to do, but to know that they have that backup and support from a pediatrician who specializes in this area is wonderful. So we're going to shift just a little bit and looking at the social determinants of health. So in the first 1,000 days, are times of tremendous and potential and enormous vulnerability. So the first 1,000 days of this baby's life, how well or how poorly mothers and children are nourished and cared for during this time has a profound impact on the child's ability to grow, learn, and thrive. So the question I have is, what should families expect during this time? And how can new parents prepare for many changes that occur in their baby's life within those first 1,000 days of life?
Well, I don't know that you can ever totally prepare for. There's a lot of things that just happen that you never expected. You may have a baby that's sicker or has more purple crying or something. So I think just again having family support. I love the I love the Boston initiative where talks about just the basics, you loving your baby and talking to your baby and listening to your baby. So those things are great. I think just being open and embracing all those changes and just trying to be educated. And then again, surrounding yourself with as much support as you can is very helpful. There's, again, more and more resources that I refer people to, not just YouTube videos on parenting, but the CDC actually has some great videos that are super good. Again, the Boston Initiative, the health department has wonderful things. WIC has wonderful things. So there's lots of resources out there that help support people. And there are going to be lots of changes. And so we try to do anticipatory guidance too that addresses those.
Nice. It looks like, Becky, you have your hand raised. You have a question or a statement?
Yes. So kind of on that note, Dr. Webb, I know one resource that we rely on a lot, especially in doing trainings and working with our hospital partners, is the AAP's breastfeeding policy statement, which is now 9 years old. So any updates on, I know they were working on revisions, and of course, COVID has delayed so many things. So I don't know if you have any inside scoop.
I do. I knew you were going to ask this question. And so I reached out to Lori Feldman Winter, and they are still winding their way through the upper leadership. So it's supposed to be coming soon. I know she told us that a year ago. I think COVID kind of slowed things down a little bit, but it is coming. So it is, the one that's there is not bad, but it is coming. So stay tuned.
Yeah.
All right. Thank you, Dr. Webb. So as we move towards the end of the questions I have and open it up to the audience, I want to make sure that I ask questions that are very timely of what we're moving into now. So available pediatric beds statewide have been scarce during the COVID-19 pandemic, especially during the surge of RSV. As we enter into the fall and winter months and flu season, what can we do as professionals to give the parents we serve the best resources to care for their children and to keep them out of the hospital?
Okay, good question. Because I don't know what's going to happen. I, like you all, feel like we're not out of the woods, and we're not going to get out of the woods just yet. Also, I'm a little worried about what our flu season is going to look like, because the message has been that we all stayed home and did a pretty good job, and we had no flu last year, as evidenced by RSV. Oh boy, that really got us. I have never seen RSV in the summer ever, and we were inundated. So we admitted more kids in the last year than I think I've admitted in the last 5 previous to that. And then a lot at OU and Tulsa. I know that they're full, well, Oklahoma City and Tulsa, all the hospitals. So what can we do? Get a flu shot, get a flu shot, get a get a COVID vaccine. And if you don't want to give that for your kids, then at least get it for yourself. The kid vaccines are going to be coming probably in 2 weeks, and we already talked about that a little bit. Flu vaccines, the little kids do great with flu vaccines. We start those at 6 months of age, and we have done those in this clinic. This clinic has been a pioneer in giving flu shots. They had started those, before most pediatricians or family practice docs were giving it at 6 months. This group had been doing that for a long time, and we've had a great success from that. It's also kept our pediatricians very healthy as well. So we've done well with that. So I think get vaccines, be sure that you're getting your other vaccines. Keep your child home. If your child is ill, don't dose them with Tylenol or Motrin and send them to school when they're sick. The other thing is we've also done really well with masking when we're in crowded spaces. And I think that helps. And kids have done much better with that than we ever thought they would. Now, once again, if they're in their same school classroom all day long and they don't change a whole lot, do they have to be masked all day long? I know that that's recommended, but I don't think that that's absolutely necessary. But if they're in with new groups, or you're going to a new place, or you're in an indoor gathering, it's still a good idea to consider that. Plus continuing to wash hands and use good hygiene. So all those things are what we do to help keep kids safe.
All right, thank you. So at this time, I'm going to open it up to the group to see if you all had any additional questions that you have for Dr. Webb. We have a few more minutes before we wrap this session up. So if you do, you can place your questions in the chat or unmute yourself to ask those questions. And I will also like to add, there's a lot of helpful information into the chat. So if you haven't seen that yet, there's a lot of great resources for you to have. Any questions? We have a quiet group, Dr. Webb. Okay, hold on. I think there's one. Heidi?
Okay, I have a question. So, Dr. Webb, so we have a first-time parent family. They have a baby on the way. It's their first baby, and they're looking for their doctor. They're looking for a pediatrician. What are like the top 5 questions that they should ask when they're, interviewing for a pediatrician?
Ooh, those are good questions. How do you, I think, how do you feel about kind of not just shared decision making? I think that's important. Not that we aren't going to give advice, but a lot of times we'll come to shared decisions. So that's an important thing. And then there's also practical matters like are you available, and your insurance plans, those kinds of things. What's after hours? What's your support there? And then you can always ask what's your position on breastfeeding and vaccines, and we hope they say yes to both of those. I can't imagine a pediatrician not, but those are important to say. Those are kind of the biggies.
All right, thank you. So we do have a question in the chat. The chat says, how are young pediatricians faring with their own breastfeeding experiences in Oklahoma?
Okay, that's a good question too, because we need to support our own. And that was raised at one of our last, I think even the AAP meeting or the Academy of Breastfeeding Medicine meeting, where we're not always doing a good job supporting our peers. And that may be even among nurses or lactation consultants or dietitians, we may get a little perturbed sometimes that our coworker is taking time to pump or having to take a little longer maternity leave we need to be aware of that. So we need to be very supportive. I think for my colleague, we just built that into her schedule, her pumping time. She was able to do that well. She usually also had some time at lunch. So we need to be sure that our residents, our new pediatricians, any of our pediatricians and fellow physicians have time allotted for pumping and for feeding and for taking time off. And so I think that's a good question overall. I haven't talked to a lot of other people. I know for our colleague, she was able to pump and breastfeed for the whole first year. And a lot of our staff has been able to accomplish that. We're pretty in tune to that, but you do have to watch your biases. And I think sometimes that can send some hidden messages to people, and none of us mean to do that, but we do have to be careful about that a little bit. Even just having coworkers that have little kids that sometimes get sick a little bit more often. We don't mean to do this, but there are times some of those hidden messages, you just have to watch your language.
I agree. That's a big thing I work on, equity and implicit bias, but we don't intend,
Yes.
And that happens. So I do have another question. I see you, Becky. And it's in the chat. So this is a two-layer question. So we talked about earlier, you talked about the referrals and having those resources available. So the question is what are some suggestions for the best way to refer for occupational therapy or speech therapy for evaluation? Do you start with a pediatrician? Does it depend on insurance? Those things. And then the second part is there a list of available therapists that we can have as providers as a resource?
I'm kind of working on a list, and I wish I had a list. We have at OSU, we did have a great feeding therapist. So, and she moved out of state. So unfortunately, we lost that person. And then we have another feeding specialist who works mostly with adults. And we've been trying to figure out how to get her more pediatric time. So it's kind of working in your own system to kind of develop that. I think a lot of times, just if there is a question, referring to who's available in your area, and then that kind of helps them learn a little bit. And it's a cooperative thing to kind of work together with that. Yes, you would start with the pediatrician or the family practice to do the referrals. Most insurance would cover, I think, a feeding problem. If you say feeding problem or dysphagia, that would cover. And I unfortunately don't have a good list of therapists. That's something that probably this organization and the Breastfeeding Resource Center, we might start to work on that a little bit, because I have found it to be very helpful in those complicated ones. And yes, somebody put up Therapy Works there. And also there's a feeding specialist, I think, of at Sensational Kids, I believe, in Edmond. So there are some other places to go. So yes.
Thank you. Becky, you had a question?
Yeah, I was just a follow-on comment to the question about pediatricians breastfeeding, and the support for physicians that Dr. Webb was answering earlier. And just to say that with the good news is that it's called the ACGME, and that's the organization that accredits residency programs, so training programs for physicians. They actually now have a lactation policy for residency. Now, it doesn't mean the policy is implemented everywhere, but they've actually published a policy that They're supposed to have protected break time and safe places to store their milk, and look at the culture of support to, like you were saying, the hidden messages and so forth. So that's a starting point, at least, to give guidance to all the training programs. And if you train them up the right way, hopefully they take that out in the community. So.
Right, exactly.
Thank you, Becky. So there is a ton of resources that this group is providing in the chat, and I'm sure we'll be able to get that to you post this meeting. But we are running low on time, and I do want to respect you all's time. So Dr. Webb, do you have any final words before I turn it over to Becky for final comments?
No, I don't at this point. I mean, one thing we didn't talk about too is just continue to advocate for children and children's Medicaid coverage. We didn't talk about that, but we really would like to not get to the managed care. We really like the way it is right now. We feel like it's working very well, and we would not like to add yet another layer to that. So just continue to hit up your legislatures, your on the local level, and tell them how important children's advocacy is.
All right, thank you, Dr. Webb, for all of the great information that you provided us this morning. Also, thank you for the great work that you're doing. In Oklahoma, I'm glad that you came back from Arkansas to share your great work and knowledge and experience. So it's our pleasure that you were here today with us and be able to provide those nuggets of information. So at this time, Becky, I will go ahead and turn it over to you for final thoughts and words.
Yeah, no, just quickly, of course, thank you, Kamisha, and thank you to Heidi for arranging this, and to Dr. Webb for making time today, and definitely all the support we see, and everyone for participating to make this a good, engaging, lively session today. And I would leave everyone with one question, both Dr. Webb and our audience today, as COBA is, as we're looking towards another legislative session, and even hearing about, the Medicaid changes, that as we're getting so much more experience now advocating for legislation to improve outcomes in our state. If you have ideas on challenges that might be addressed through legislation or through educating legislators, and sometimes even doing an interim study like we did on the incarcerated women, we might not need to pass any laws. We might just be working with the Department of Corrections to implement some policy changes. So if you have ideas and see situations that we can help advocate and address, then send those our way. And once again, if you want to get more involved in COBA, contact Heidi. So, all right. Well, I think we will call this a wrap, and let everyone go about their day, or get lunch if you haven't had lunch yet. So thanks to everybody.